way, which is not good. We should have celebrated Happy New Year in a better way. But unfortunately, the COVID second wave is in Lagos and it is real. So we have to stay alert. And for that purpose, all of us are here today just to hear the doctor's advice. There are two doctors, one medical practitioner, facility management MD, Chief Grover, and Professor Hiran also is there, who is expert in the COVID infections. So we'll hear and how we can protect ourselves. So that is the objectives of having the meeting today. In addition to that, let me inform you on behalf of SABHA, this is the 20th webinar we are going to have today. We thought we will not have any webinar for the COVID, but unfortunately we are having it today because of the second wave. And the hospital, it has been closed down after having run for 6 months, Indo Eye Care facilities, which is initiative of SABHA. But now, here all these things we have witnessed, there are so many deaths in Indian community and also in Lagos. So that's why SABHA coordinating team has already approached Ministry of Health, and Ministry of Health and Lagos State Governor has given the approval to reopen the hospitals. So it is a good news. And also we are fortunate to have the medical facilities inspected by the facility management of LASEMA, who have come today. They are verified. And also the resident doctor who is going to be in charge has informed that within a couple of days, they will be starting the facilities. So it is a very good news for all of us. So for that, the detailed discussions will be done by our MOH coordinator, Mr. Paul Singh, in a later stage of this meeting. He will update exactly when we will have the hospitals for all of us use. So with this, I will say thank you all for the support to the SABHA, and SABHA will ensure to take care of all Indian communities, whatever the best possible way it can. And with this, let's go to the webinar awareness programs, and so that we can hear doctors, so that we can protect ourselves. Thank you all. Welcome to this webinar. Thank you. Pravinji, please.
Thank you, Rameshji. So next, I want to give this podium to Sri Chief Grover Sahab to start this webinar. So people will get the benefited for this webinar, this pandemic time. So Chief Anil Grover Sahab.
Thank you, Parveenji. Namaste and good evening to all the leaders from Indian community as well as the officials from Indian High Commission. With due respect to each one of you today available, all protocols duly observed. Wishing all of you a very happy and healthy New Year 2021. Unfortunately, we all are passing through very difficult times when the second wave of COVID pandemic has hit Nigeria and West Africa recently. And it is our privilege today, and we are grateful to Dr. Akase, who accepted our invitation to speak to all of us to enlighten us more on the recent developments and recent trends into the coronavirus infection and into the management of this disease. Before I invite Dr. Akase, I would like to say a few words to introduce him formally to our Indian community. Dr. Akase, we are grateful to you to accept our invitation to be our guest speaker today as a expert person into this COVID management. For most of you who do not know Professor Akase, Dr. Johan Akase is a very senior consultant and head of the department in infectious disease unit at Lagos University Teaching Hospital, popularly known as LUTH in Idiaraba Surulere, Lagos. He is the team leader of LUTH COVID-19 response team, and he is also a very active member into Lagos State Emergency Response with the NCDC team. Professor Akase has a very rich experience in the management of patients with infectious diseases, including in the past also pandemics like Lassa fever and now in last 1 year, COVID-19. He has a master's and post-graduation in the field of immunology as well as infectious disease management. He has a research and leadership experience locally as well as internationally. He has led the research projects in virology and infections management. And currently he's leading the team into research in LUTH Teaching Hospital, Lagos. And he's also the unit head of isolation center in LUTH Hospital for COVID management. In the past, he has done a lot of research papers presented on HIV management, sepsis management, and the field of mycology. It's my privilege to inform you that Dr. Akase is also the chair of Oyo State Committee on the accreditation of isolation center facilities in Oyo State. He has written a lot of publications and served a lot of written a lot of articles in the journals in the infectious disease management. It's my pleasure to introduce Dr. Akase to all of you. Thank you very much once again, Dr. Akase, to accept our invitation. It's our honor to have you as a guest speaker today so that our Indian community can understand from you what is happening recently on the second wave of COVID-19 in our country. Over to you, sir.
Thank you very much, Chief Dr. Grover. It's such an honor to have you introduce me in such glowing terms. I am honored and grateful to the SABHA leadership and to the Indian community as a whole. I count this a huge privilege to be called to speak to you. I hope that in a few minutes will be helpful. I will share my slides now.
Thank you. Ladies and gentlemen, one request. We will not ask the questions during the presentation. You can keep noting down your questions. So after the presentation is over, then you can send your questions to moderator Praveen sir or to me, and then we will answer most of your questions one by one.
Okay, thank you, sir. So I understand that this is not a medical community. So I'll try to be in the next 19 minutes to be short, just straight to the point, so that I don't overlap the point. So as a way of introduction, we know that COVID has been with us for the past 1 year, and while I will not go into the science, over the past few months we have had new waves, second waves or third waves in some countries, and also new mutations that have come up in the area of COVID. Now, this slide, I want to just use it to show us two important things that we're going to be discussing in subsequently. One of them is, you can see this is a diagram of the coronavirus, and on the body of the coronavirus, you have some projections that look like sharp spikes that are coming up from the body of the coronavirus. Now, this coronavirus is called severe acute respiratory syndrome coronavirus 2, also known as SARS-CoV-2. And the disease that this virus causes is called coronavirus disease 19, also known as COVID-19. Now, it is these spikes that are coming from the body of the virus that the virus uses to enter into the body of the organism, usually through the respiratory tract and into the lungs. And the special receptors that attach to these sharp cells are found mainly in the lungs of the human beings. So after somebody gets infected with the virus, what happens inside the body? There is what is called an incubation period. After somebody gets exposed to the coronavirus, the person has an incubation period. The incubation period is a time where somebody is exposed to the virus, but he is fine. He doesn't show any form of symptom. He is fine. This can last for up to 14 days. Now, after 14 days, for some people, nothing will happen, but some that develop the COVID, they enter into the first stage of COVID, which is called early stage. In this early stage, they have the fever, they have the joint and the body pains. And in Nigeria, we have most of our people, they say it looks like malaria. We know malaria is quite common. They say someone has malaria. So it looks like malaria, just fever. And sometimes they cough, sometimes diarrhea, vomiting, just like malaria sometimes, or like something else. And this stage may last for up to 1 week. And then in some people, they may recover, no problem. Just a sore throat, loss of smell, and then they will recover, no problem. But by the time they go into the second week, so in this first stage, the virus is moving around, is plenty in the body of the infected person. And all the symptoms are because of what the virus is doing in the body of the human being. But by the second week, as from day 8 to day 10 or day 12 thereabout, the virus is reduced in the body. However, the body now develops immune response against the virus, and the body begins to develop what we call inflammation. Inflammation refers to if a situation where somebody gives you it slaps you, or you receive a cut on your hand. If you see that there's redness and swelling around the area of your injury, that is called inflammation. So the COVID, in the second week, the COVID will cause inflammation in the lungs. It can cause inflammation in the kidney, and it can cause inflammation elsewhere. And at this time, the person now starts having problem with breathing. His oxygen starts going down. And then also some organs start having problems in the kidneys and also in the brain and elsewhere. This is not because of the COVID virus. This is because of what the body is reacting. So by this time, in fact, the virus is low in the person's body, but the body is reacting and there's a lot of inflammation, and this is where complications occur. So to summarize, in the first week, it's just virus and no problem in the first week. But in the second week, severe problems, okay? Complications can occur in the second week, and that is where we have to be very careful, all right? So if somebody is having cough and fever quickly, and he takes action in the first week, he starts treatment, the chance of recovery is better. But if there is a lot of delay at home, somebody didn't come to hospital on time, or the diagnosis was not made on time, and complications start in the second week where there's difficulty with breathing, or the person needs oxygen or something, then already there's complication and there may be problem, okay? So just to mention the statistics, in Nigeria so far, we have 95,000 cases. And I will come back to this slide just before I finish to show us why it's so important to do some of the things. So 95,000 cases, over 77,000 have recovered, just 1,300 deaths. However, this has changed suddenly over the past few weeks, as we'll see in the subsequent presentations. So to summarize again, this is another chart that shows us what happens from the early infection to the stage where somebody is coughing, and then where there's so much inflammation, we call it the hyperinflammation, where complications can occur. So if somebody has COVID, and by the time he's having shortness, difficulty with breathing, that means he has been sick for up to a week. Maybe he didn't know it, or something, and it's so important to come on time. So this chart shows us what we call the second wave. When we say the second wave or second spike, what does it mean? From April in Nigeria, we started having cases in February into May in Nigeria. But by June, we had what we call the spike, the first spike, which was the highest number of cases. But by September into November, everything went down until in early December when we had another spike again. You know that if yesterday we had over 1,565 cases diagnosed. So this new spike is what is called the second spike. Now in Lagos, you can see the same thing from March into April. You have seen a spike in number of cases, but in August into September, everything has returned to normal. But in December, we are now having the second spike into January of 2021, and that is the problem. So what are the observations in this second spike? And that is what I will just, what has happened, what have we observed in this second spike? One, we have seen that in the first spike, a lot of cases were mild, not much problem. Most people recovered without much deaths. But in this particular spike, we have seen more severe disease. People were having slightly more deaths than the first one because people are coming more severe this time compared to the first one. Again, what is another observation? Number two is that, we know that most of the problems in COVID occur in elderly people who are more, in the older age groups, and people who have diseases like diabetes and hypertension and heart problem and so on and so forth, or asthma. But in this second spike, yes, we're still seeing problems in the elderly and those with diabetes and hypertension, but also we're seeing younger people who are having severe disease and some even dying. In the past 2 weeks, I know 5 young people who have died from COVID in their 20s and in their 30s, who have severe complications requiring ventilator and so on and so forth. So what has been, and then the third observation is that most of the people we are seeing now are people who took a lot of precautions in the first wave, and so they were safe, they stayed at home, so they were safe. But after everything went down, they relaxed, and and so they are not getting infected because they have relaxed the precautions. And what are the contributing factors that have caused this? Schools reopened late last year. The youth orientation camp also opened. People have resumed back to office. And, while they're in offices, they're not paying attention to the basic things anymore. And then worship centers have also opened with large crowds. People are going to parties and attending weddings, and they are not complying with the directives of the NCDC. And the directives are the major directives are just simply 3. It is, do hand hygiene and respiratory hygiene. That is 1. 2, put on a face mask. And 3, social distancing. If you do this, this still remains the 3 basic tenets of COVID, of precautions in the section of that. So what have we also observed? Our hospitals are getting filled up. Doctors and nurses are getting overwhelmed because the cases are increasing rapidly. And we all know that Lagos State government had closed down. I heard the chairman of the SABHA mentioning that there's a process by the Lagos State LASEMA to inspect and reopen some of the facilities that were attending to the Indian community, which is very, very good because Lagos State closed down many of the isolation centers. So it's in Lagos at the moment, only 2 government centers are open to take COVID patients. This is Luth, my hospital where I work, and also the IDH, which is the mainland hospital in Yaba, which is the biggest hospital for COVID in Lagos. Then we also have a Federal Medical Center, Ebutemeta, they have a small facility, can take about 8 people or so. These are the government facilities that are attending to COVID patients, just 3. Then we have 3 major private facilities that are attending to COVID patients in Lagos, especially people that have complications. And these include Reddington in Ikeja, there's Pelon in Ikeja, and there's Vedic in Lekki. In addition, there are also a few private facilities here and there that are tending to, patients when because of, lack of space. What has happened over the past few days is that most of the facilities are getting filled up. Oxygen is becoming a challenge. Most of the medications are so. There's a lot of reasons why it's important for us to hold this lecture and to discuss the ways how we can stop this from going on. So in terms of treatment, and as I conclude, I'm going to mention what is the effect of this thing. So in terms of the treatment, what is our experience and what has worked for us so far? We have observed very strongly that supportive treatment is very, very important. We like that people should drink a lot of water, and also steaming and other supportive treatments are very, very important, along with and I know that the Indian community has a lot of experience with steaming, because I learned a lot from one of my patients who taught me a lot about steaming and how steaming can help. A lot of fluids and healthy eating, which also treat comorbidities like diabetes and hypertension, very, very important for survival in people who have COVID. Then vitamins, especially vitamins D and C and zinc, very, very important, both to prevent and to make us healthy, and also to help the immune system to respond. This is so important to help the immune system to respond. And then antibiotics, we treat and give antibiotics, azithromycin, augmentin for people who are coughing. The antibiotics do not treat COVID, but they treat the other bacteria. COVID is a virus, so antibiotics do not work on viruses. However, because when somebody has a viral infection, bacteria can go there, and so we treat it with antibiotics. So over the past, there have been a lot of drugs that have been used, which we find out that they are not so useful as we thought it was. One of them is hydroxychloroquine and chloroquine. A lot of it has been used by, I'm sure, some of us here, but the evidence have come out to show that it's not very, very useful, except where there are some few cases, but on the long term, it's not found to change much in terms of patient outcome. Our own experience has shown us that we did a clinical trial with hydroxychloroquine and chloroquine, and we found out that it really didn't change much in terms of patient outcome. So favipiravir is a medication that is widely used, especially in Asia and elsewhere. We have a little experience with it in Nigeria. In my practice, I've not used it much. I have managed a few patients who got it in, and the experience is fair, to be honest. But like I said, we don't have much experience with it here, so we don't use it very frequently. Ivermectin is a cheap drug, and for those of us who are following trends, it's generated a lot of interest over the past few weeks or so. We did a clinical trial with it, and I'm going to share with us that paper in the next page about ivermectin. It's cheap, and so far the results are promising. Of course, we all know about remdesivir, which is widely used in America, but it is expensive, and but it's available for use. We use it. I've used it in some of my patients, and it's been quite helpful. We use colchicine in some patients, and also tocilizumab, which is especially in people that have the cytokine storm in the later stages of the infection. So it's also important in reducing the inflammation that patients have. And also convalescent serum refers to blood that has been taken from people who have recovered from COVID. And it's also quite helpful in helping people to recover quickly. So dexamethasone is very, very important. In fact, it is one of the most important interventions in COVID. And it is useful in people who have already developed inflammation. That is, those who are already on oxygen or are having difficulty with breathing, or if they do a chest CT scan, there's something we'll see on the chest CT scan that make us say, oh, we need to give this person dexamethasone. So it is a steroid. It uses to suppress and reduce the inflammation in the patient. So in our practice, this is what we have used: fluids, vitamins, antibiotics. We also use ivermectin and remdesivir, and I've used tocilizumab in a few patients, and the convalescent serum. But dexamethasone is so important in I'm managing my patients. So also when patients come, I try to do the chest CT scan first to see how much of the lung has been affected by the COVID, and also to help me guide and advise the the patient relatives so that they can understand how we are managing the patient. We also take blood and we do tests to see the extent of the inflammation and also to guide our treatments, accordingly. So this is like I said, this is a short presentation, and I wanted to keep it simple so that I can always answer questions when I finish. But this is the trial that we did, a clinical trial with ivermectin that we did. I'm one of the authors. We published this in a pre-print 2 days ago. And it shows that ivermectin has a lot of clinical benefits in patients that have mild to moderate COVID at least. And in our trial, a summary of it is that people who we treated with ivermectin recovered 5 days earlier than those that we didn't treat with ivermectin. We also treated them here with chloroquine and hydroxychloroquine, and also with antibiotics, and also with lopinavir and other forms of antiviral. But ivermectin performed very, very well, and we are very excited about the promises that this medication holds. It's cheap, it's easily available, and it's something that we feel can be very helpful, especially in poor communities and people that cannot afford other forms of that. Now, before I go to the vaccine and finish, I want to show us something. Now, on this diagram is very, very important. By the end of April, May, the cases in China were about 83 to 85,000 by the end of April, May, when other countries have started to develop increasing number of COVID cases, 85,000. From May up till now, China's cases are still 92,000. So for over 6 months, China has had as a whole just 8,000 to 9,000 cases in the past 6 to 7 months. By the time China was having 85,000 cases, Nigeria, we had like 3,000 cases. Now Nigeria has 95,000 cases. Countries like United States, countries like India, and other countries are having cases in the millions. What lesson can we learn from Japan, from China? And that is what I think is very, very important message I needed to pass across, is that no matter the sophistication of your healthcare system, no matter how much resources you have as a country or as a hospital, if we are not controlling the number of infections happening in the community, eventually we are going to have more mortalities. So what is the key to controlling COVID? It is not yes, the vaccine is very, very important, and I think it's going to help reduce the number of infections in the community. But we know that vaccines, to be helpful, that will be for the next 1 to 2 years before we can have sufficient herd immunity to protect us. Our only hope is to break the chain of infection from one person to the next by wearing a mask, doing your hand hygiene, and also staying away from crowds and doing social distancing. That is what China did. They broke the chain of infection. Now, I learned that in Wuhan, a few days ago, they had only one infection, and for weeks, they didn't have any infection at all, which was the epicenter of this infection for that. So that is a very important lesson before, as I try to close. So vaccines, I know we've heard so much about it. I did this diagram to just give a summary of some of the most popular ones that are out there. We know about the Pfizer and the Moderna, which are RNA vaccines, which are very effective, especially the Moderna. The Moderna seems to favor us here because the storage capacity, the storage requirements are less, 20 degrees. We can do that, and then the protection is better. And the other ones, all of them require two doses, and a lot. So as this spreads out, the protection is going to be more. But like we said, we may need to look at other forms of cheap preventions and medications, and then also people being careful in terms of doing that. So what is a summary of what I've said so far? I took a longer time than usual, I apologize. But what is the summary? The summary is that we have we really have a spike in our hands. And what are the characteristics of this spike? It is that we are seeing more severe cases. We're seeing younger cases. You're seeing younger people having severe disease and having mortality. And it is important for us, and we can, if you go around in Lagos, see nobody's wearing face masks, people are not stopping the spread of infections, and we're putting, our neighbors at risk. So we have hope, but we have hope. And what is that? That we have found, evidence that some of the cheap drugs that we have available can be very helpful in treatment and also in prevention. And also that if you start having symptoms of any type, go get tested, because if they diagnose your COVID in the first 1 week and something can be done, the outcome is better. But if somebody waits until he starts having difficulty with breathing or his oxygen is started going down, already complications are coming and the outcome usually is not very good. And lastly, when the vaccine comes out, I encourage everyone to try and get it. But even after you get it, it's important to remember that the 3 basic principles of prevention still stays. If we apply this crucially, we will do well. One of them is to wear your nose mask at all times and in the proper way. 2, to make sure your hands are clean and you use hand sanitizers and wash your hands frequently. And 3, to avoid crowds and to do that. I can tell you categorically that the new variants of COVID is changing. There are new mutations that have occurred, but these new mutations only help the COVID to spread faster. If you still wear your mask and wash your hands and stay away from crowds, we can still beat COVID. But if you don't do that, if you're still attending parties and gathering the crowds, it's going to be very, very difficult to beat COVID with these new variants, because it's more easy to transmit, and it seems to be more severe, and it's killing faster, and it's affecting even younger people than we knew before. So I want to thank you so much for listening to me, and I hope I was able to communicate something. Chief Grover, over to you. Thank you.
No, wow. Wow. Can we give him a round of applause, please? Dr. Akase, wonderful presentation. I'm sure the leaders of our Indian community have learned a couple of new things from your presentation. And with your presentation, you have made my life easier also, and you have made my life more difficult. Easier in a way, you have explained them things in a very simple way, so that now in my presentation, I don't need to cover the medical part, and made my life difficult because after the Guru has spoken, I don't know what are the things I'm going to add. But I'll add few points and would like to share my presentation for a few minutes. And after that, we will open the question answer session. Is my screen visible? Can somebody respond?
Yes.
Yes, Chief, it is okay. It is visible.
You just make it to the full, yeah, now it is okay.
Okay. Thank you, Pravinji. I would like to add a couple of points which are related more to the second wave of COVID pandemic, and with the new developments into the after the mutation of coronavirus SARS-CoV-2. As most of you know, this is how coronavirus looks. Because of its spikes and crowns around the ball, that is why it is called corona, because it looks like a crown. So what new mutation or new strains of COVID-19, which coronavirus, which is coming in the lot of countries, is they have changed the structure and the positioning of some of the spikes. By changing the new mutation, the coronavirus has become now much more deadly in medical complications due to two reasons. It has become faster transmission now, and it has a deeper penetration now into most of the systems and organs. In terms of pathogenesis, only one point which I would like to highlight, which has been said by Dr. Akase also, the point of entry, the how coronavirus enters our body is either through the nose or through the mouth. And through the nose or through the mouth, it enters our respiratory system, or the recent one, the latest second spike or the mutated coronavirus also enters our epithelium in the gastrointestinal GI system. And that is why you see the change now recently into the pattern of clinical presentation. The recent second spike, we have seen the patients, which was not common in the first wave. The patients are nowadays complaining loose motions, watery stools, diarrhea, cramps in the intestines, because they have invaded the GI system and start causing inflammation into the abdomen itself, in the abdominal cavity, as well as a lot of infection cases are these days coming with UTI infection, kidney infections. This is a new thing which was not there in the first wave of COVID-19. And once they enter the respiratory system, they attach into the host cell. And after that, the host cell starts bursting, which causes the complications and spread of infection to other organs. In terms of symptoms, how do you differentiate that whether somebody has COVID-19 or not? Recent trends have shown, apart from fever or apart from the cough, the new thing which is emerging is complete myalgia as well as muscle pain and cramps, along with the loose motions and diarrhea, vomiting. This is a new trend which we have seen in the second wave. And there is another thing which is emerging recently in last 3 to 4 weeks, which was not the pattern in the first wave, that most of these patients which are coming these days, they are heading towards ARDS, acute respiratory distress syndrome. That is why these days in most of the patients, they require external oxygen or ultimately progress towards ICU admission or ventilation. That was not the case in the first batch of corona infection. So symptoms are a little bit changing, and picture clinical presentation is different in the recent spike of COVID-19. This is a universal golden truth, as highlighted by Dr. Akase also. If we want to break the chain of this COVID transmission, the cheapest and the most well-established method is mask. Cover your face, cover your nose, cover your mouth, cover your eyes, cover your head. That is the best way to stop the transmission and break the chain of this COVID-19 spread in Lagos and in Nigeria. And ladies and gentlemen, please understand one thing. Any country which has tried this, be it Japan, be it South Korea, be it Singapore, or Kenya, a small country like Rwanda, Uganda, even in Ghana, they are able to stop the transmission or reduce the deadly infection rate or control the spike with this simplest and most preventive and most effective method, using mask, please. And a lot of people in our community recently, during the Diwali days, during the Christmas days, and during the New Year celebrations, people have been seen doing parties without wearing mask. They are sitting in a restaurant, in a group or a club without wearing mask. And that is where actually the COVID got a chance and has beaten us in the last 2-3 weeks. And we have seen the trend. Many people in our community, they are getting prey to this COVID-19 now, because we gave them the chance. We gave COVID a chance, so that now we need not to be casual again. In terms of symptoms, I would like to again highlight that high fever or high spike fever comes. Cough is most of the time non-stop. Shortening of breath is there. And ultimately, the person is gasping and looking for external oxygen. These are the very common trends. And muscle pain and joint pain is also recently happening in the second spike. So these are the symptoms which you should watch. and inform within your family members, those who are not listening to the presentation today. I would like to highlight the people on the high risk again. Smokers are one of the highest risk people to catch this infection because their lungs are already compromised. People with old history of asthma, COPD, cardiovascular disorders, and diabetes. These are the people who are at highest risk, and especially elderly people, because elderly people and cancer people, they are already immunocompromised. Their immunity is already weak. So these people have to be more careful and observe them closely so that we can protect them. This thing has been highlighted already by Dr. Akase also. Within 2-3 days, if you are at home and if the symptoms are persistent, now do not wait. Immediately go to the government facility or a private lab where you can get tested with the swab PCR test to know your COVID status. This has been highlighted in the past also, that since last 1 year, we have learned if somebody has a COVID, it is not a must that it's a death sentence. More than 80% people have survived the COVID, especially those people who do not have additional comorbidities like diabetes or hypertension. Most of them, they survive very well. Within 2-3 weeks, a person recovers and go back to the normal life. And we have seen, and Dr. Akase has already highlighted, there are various line of management and treatments are available. Especially, I would like to highlight here that response with the chloroquine or hydroxychloroquine or chloroquine is not good in Africa, in West Africa. So people should caution and stop using as a self-medication or as a prophylaxis. A lot of people we have seen, they are taking pills of chloroquine or hydroxychloroquine at home. It's a warning to them. Please stop it. Rather than taking care of COVID, you will land up into more complication and cardiovascular side effects. There are other drugs available to manage COVID clinical situation. There are other good antiretroviral drugs available in Nigeria to treat COVID and other secondary infections. There is a blood transfusion available. Human blood plasma transfusion therapy is available for critical patients, although more research has to be done in that. This is the area which I would like to highlight in our community. Due to background of Ayurveda in India and Asia, there are a lot of things, good things available, which we call as immunity booster. There are local kada available as per our Ayurveda therapy. I would encourage each and everyone to start taking the kada in the morning as well as Ayurvedic kada in the night also. That will boost your immunity. If anybody needs, we can send the recipe how to make those local kada to boost your immunity and to raise the T cells, immunity cells. There are certain fruits and vegetables which are available, cheap things to raise your immunity, so that any fruits and vegetable with high pH content, with high content of zinc, to increase your immunity. Turmeric powder, haldi, is one of those things. If you mix it with ginger, lemon, as well as garlic, these are the things which boost our immunity, and remedies are available locally also, easily available. These are some of the fruits and vegetables and local things which are available to give you strength, boost the strength of zinc, vitamin C, as well as vitamin D available. Few recommendations for each and every one, ladies and gentlemen. And the most important thing is, please stop doing self-medications at home without confirmation of COVID screening, without doing swab PCR test. A lot of people we have observed, they start taking antimalarials and antibiotics at home, even if they are not positive. These things are not going to work as a prophylaxis, especially for virus management, especially for COVID. They won't help. Rather, you will land up into side effects. If you have symptoms, please meet your physician, consult a virology specialist to treat you very well in the hospital. Even if you want to have a home quarantine, but make sure you do the test first, meet your physician, take a proper treatment, and somebody should need you monitoring regularly at home also if you are stable. But do not treat yourself on your own at home without the supervision of a doctor or a clinician. Another medical advice is, which we have seen recently, that people, they have gone to some of the local quacks, or people, they have gone to juju treatment. This virus is not a juju, it's a real. So juju or local quacks kind of treatment, they are not going to help you. Please stay away from the parties. Do not go to the crowded place. As far as possible, avoid meeting strangers. You don't know their status. And whenever you have a doubt, if you start developing symptoms within 2-3 days, there's no harm. Get yourself tested. At least 7-8 good private labs are available in Lagos State, apart from government facilities, where you can get the swab PCR and confirm your COVID status. IDH, Yaba, Luth, Naimer, still they do the COVID screening. You can do your test at government facilities, which is absolutely free. Other 6-7 private labs are available. Reports are available. Result is available within 24 hours. And once you are confirmed positive, declare yourself that you are positive. Stay away from other people. Isolate yourself either in home or go to the isolation center or in a private recognized hospital for a treatment. Thank you very much, ladies and gentlemen. And now we will open the floor for question and answer. Feel free. We are available to answer your queries. Thank you. Over to you, Vishwalji and Parveenji, over to you, over to our community.
Thank you, Chief. Thank you, Doctor. Having this knowledge sharing, and I'm sure all of the members, they have got some informations and everything is informative. Thank you. Over to Praveenji. Chief, you can start taking questions, please.
Sorry, my microphone was mute. I've done the unmute now. The first question I've received is from Mr. Vijay Mishra, that which are the hospitals available for treating COVID patients in Lagos? Luth Isolation Center is available. IDH Infectious Disease Hospital, Yaba, is available, as well as FMC Abete Meta is available in government hospitals. And in the private hospitals, also a couple of hospitals are available. Vedic Life Hospital is there. Pillion Hospital is there. St. Nicholas, Maryland branch is available. Reddington's branch in Ikeja is available to treat COVID patients. And few more hospitals are going to be accredited very soon. And isolation center of SABHA, which is at Indo Eye Care Foundation Hospital at Ajao State, will be also open from next week very soon for admissions. Next question is, I have received when the vaccine will be available in Lagos. As far as last week NCDC reports are available, at the moment vaccine is not available in Lagos, but very soon Federal Ministry of Health and Lagos State Ministry of Health, they are trying to make some arrangement and tie up with the Oxford AstraZeneca vaccine, as well as Pfizer, where those vaccines will be available very soon in Nigeria. But at the moment, no vaccines will be available for the public until unless by end of February or early part of March. Any next question? Next question is, somebody has asked, antiretrovirals, are they available in the COVID treatment centers? Yes, they are available as per the NCDC protocol. Those drugs are available in most of the hospitals. Antiretroviral drugs are available as per NCDC protocol. They are available, yes. Next question I can see is, how much it costs for COVID treatment in private hospitals? There are different type of price range is available in the market, starting from 500,000 naira per day up to 1 million naira per day in private hospitals. And if the patient goes to ICU, even the charges are up to 1 or 1.5 million naira per day. Any other question? Feel free. If somebody wants to ask, you can unmute your mic and ask the question.
Chief, Dr. Akase has mentioned about two drugs. That last was the dextathan, and another one is the Everton. These are the very much effective.
Yes.
Can you just put more light on that, and what is the dosage and how is the administrations, so that everybody can have knowledge?
As Professor Akase mentioned, drugs like ivermectin is a anti-parasitic drug, which used to be very helpful in old days when we were treating scabies patients. And now first clinical research was done in Australia and Singapore that ivermectin has been very helpful to eradicate coronavirus. A lot of countries, a lot of studies are available in Lancet also, and international institutions like Johns Hopkins have also tried ivermectin. This drug is available, quite cheap, very effective. But my only advice again is, Bishwalji, that people should not start using as a prophylaxis. The moment you start telling them the dosage and administration, from tomorrow morning you will see shortage of ivermectin in Lagos. People will start using and buying at home, keeping at home, and start using even if they are not infected. It does not help at all if you are not infected. And same thing, dexamethasone is a known steroidal anti-inflammatory drug. Dexamethasone is like a double sword. In leukotriene storm or inflammatory barriers in infections like bronchitis and pneumonia, it is really helpful to reduce the inflammation in the blood vessels, in the epithelial infections, even in the respiratory parenchyma. But dexamethasone is a steroid drug, cannot and should not be used on your own without the supervision of a medical doctor. Otherwise, it has serious side effects. It can cause even serious anaphylactic shock if people start using on their own.
Okay.
Good evening, Doctor.
Dr. Akase, would you like to say anything about dexamethasone and ivermectin?
No, you're very accurate. I agree entirely with you. It's not to be used indiscriminately, and dexamethasone has a lot of side effects, like you rightly said. I agree with you. Yes, perfectly. Correct.
Yes, sir. Yes. Somebody has asked a question now on the screen. I can see, what is the probability of virus entering through eyes? Dr. Akase, somebody has asked the question. Mr. Hemant Sharma has asked the question, what is the probability of virus entering through eyes, through the corneal parenchyma?
Okay, yeah, the probability of virus entering through the eyes is high, especially when you are very close to somebody who is actively coughing and or laughing loudly close to your face, or when you are, for people who are healthcare personnel, when you are doing a procedure that causes aerosols or particles to come up and enter into your eyes. So, but for the general community, and that is why generally, if you are going into a crowded area, it's better to always have a shield for your face as well, and that. However, like Dr. Grover, Chief Grover has said earlier on, wearing of the face masks, because the nose and the mouth still remain the highest. Yes, you can see a face shield that Chief Grover is putting on there. Quite effective in protecting the eyes because the virus can enter through the eyes. However, like Chief Grover has said earlier on, the face mask is by way, because the commonest way the virus comes is through the nose and the mouth. So the face mask is by way very effective. But when you cannot avoid coming into close proximity to someone, even temporarily, you should make sure you put on a facial eye covering as well, because it can enter through there, especially if someone coughs, or if you use your own hand and touch your eyes as well, a contaminated hand, it can enter through the eyes. Yes.
Somebody recently asked a question which was explained by in the presentation slides of Dr. Kase in the second slide. One gentleman asked the question, it's a how long is the incubation period once the virus enters your body before it manifests into clinical presentation? It was already explained. It takes from 2 to 14 days depending upon your immunity. It takes an immunocompromised patient, already COPD patients or smokers, you will sign these symptoms within 4 or 5 days. And in some people where the immunity is strong, it may take even 2 weeks before it is converted into medical presentation. One gentleman again asked a question that most of these drugs are they available in Nigeria? Yes. Now most of the medicines are available in Nigeria. It's not a problem. Initially, when the COVID started, drugs, antiretroviral drugs like remdesivir, they were not easily available. Now they are available.
There's a question, Chief Grover, that says, now in this recent serious upsurge, only few centers are open for treatment,
Yes.
when most centers were open. Are you addressing that?
Yes. During the first lot, when Nigeria was going through the initial phase of pandemic, Lagos State opened Onikan Isolation Center, Landmark Isolation Center, Bagada Isolation Center, Lekki Isolation Center. But as Dr. Akase mentioned, around August and September, the COVID wave went down completely. And there was a time in the month of September and October in most of these isolation centers, against the capacity of 100 beds, only 2-3 patients were admitted. Even people were getting infected, but they were not coming forward to go to the isolation centers. There was some kind of a myth. People were still trying to treat at home. So at that point of time, it was a socio-economic reason. Ministry of Health or any government cannot afford to maintain operations of those expensive isolation centers. So ultimately, government had to shut down those centers because medical doctors, nurses, they were there. And there was an operating cost of 30-40 million naira every month to manage those centers. Whereas patients were not going there. So government decided to close down, NCDC decided to close down those isolation centers. That was the reason. And now in the second wave, as I mentioned, we are in touch with Ministry of Health, with the Commissioner of Lagos State to open our Indo Eye Care Isolation Center at Ajawa State, at Indo Eye Care Foundation. Very soon it will be opening, which has a capacity of 50 beds. It will open very soon by next week. What is the probability of affecting children? Very low. The children have very high immunity, and so far the clinical results and trials have shown, and the word all over the world, children are the least affected so far. Very, very few cases have come which are children who are COVID positive. That's a good sign. I would like to mention one point which I missed in my presentation, which is a new thing which all of you should take a note. Any one of you, if you are going for a COVID screening test, please do not encourage rapid tests. Please go for proper swab PCR test, RT swab PCR test, polymerase chain reaction swab PCR test. In any lab, when you are going for the test, please ask viral load values, or please ask the lab what is the CT value. CT value is called cycle threshold value. Once we know your CT value, a clinician or a physician, we will be in a better position to understand how gravity of the viral load you have and how severe is your infection. If your CT value is less than 25, that means you are at more risk for a progression of the disease, and you are at more risk for a admission, and it can lead to more complications if your CT value is less than 25. If your CT value is more than 25 or around 30 or above 30, you are mild infected. Viral load will be less, infection will be less, easy to manage at home. That gives a barometer for a clinician to decide whether you can stay at home or you can stay in the hospital under close supervision. So whenever somebody is doing the test, I've seen these days a lot of COVID reports where CT value is not mentioned by the lab, but when you ask them, they give it to you. So please insist for CT value, or there are some good labs, they even provide viral load value. That gives a barometer and a parameter for us to manage you better. Any other questions? Somebody recently asked, Pinaki Dada has asked, that what are the chances of if somebody had a COVID in the first phase, can you get the COVID infection again? Can you have a relapse of COVID? Professor Akase, if you can answer that. Relapse for the second time.
Okay, thank you. So theoretically, the answer, and even in practice, the answer is yes, you can get COVID again. Today, I have a doctor friend who came, who was infected the first time with mild symptoms. In fact, she didn't have any symptoms at all. But today she came and she's quite symptomatic, and we did the chest CT scan and we're seeing features of COVID. I've sent her to go and do a PCR today. So, and that is why we advise, even if you have had COVID before, still obey the precautions that have been listed. Because yes, we know there's an immunity that, it comes after COVID, but we don't know for how long that immunity lasts. And it may be different in some people. Some may have strong immunity after COVID. Some may have a weak immunity after COVID. And since we don't check the immunity levels of people after COVID, it's better you obey the precautions and not expose yourself to. And even after the vaccine comes, and I think that's what I need to emphasize, even after the vaccine comes, when you take your vaccine, still obey the precautions. Wear your mask when you go out. Because there's something about COVID that we already know. One, it's not just COVID, all viruses, they change shape quite quickly. And so it's possible that the variant one is exposed to before, you could get exposed to another one, which is different. So in theory, that's a possibility. Two, the dose is also important. So if your immunity is not so strong, but you have a very high dose of exposure, you could also get infected. So there are many reasons why, even if you have immunity, whether it is naturally through an infection or through a vaccine, you should still obey the measures of putting on a face mask, washing your hands, and staying away from crowds if you don't have to be there.
Thank you, Professor. Thanks, Dr.
Okay.
Akase.
Dr. Akase, good evening. My name is Romy. I have a question to ask you that suppose a patient is asymptomatic and you're not aware that you're asymptomatic, right? You don't have any signs, you don't have fever, you don't have a sore throat. Doctor, can you hear me?
I can hear you. I can hear you.
All right. So if you're asymptomatic and you don't have any signs of being COVID and you're not even aware that you are COVID positive, but can your blood start forming clots without you even knowing about it?
Okay, thank you. That's a very good question. So in reality, most people that have the degree of complications has also to do with the viral load. The higher the viral load, the more strong the immune response, and so therefore the more risk of developing complications. However, in theory, if someone has an asymptomatic infection, by virtue of the immune recovery, by the time it starts forming, between the phase where the virus meets the immune response, in theory, it is possible to have, in theory, but the risk is very, very low, if not absolute. But in theory, it is a possibility. So therefore, but the risk is very, very low. We won't say it's not possible. It is possible, but the risk is very, very low. Therefore, that's why we don't advise. So for that reason, you wouldn't advise everyone to go and start taking anticoagulants or antiplatelets so that they'll prevent clots for COVID. So, in general, if somebody is asymptomatic, he is expected to be active and moving around and doing things. The level of activity will also mitigate and prevent him from getting blood clots in areas where he does not do that. So, while it's a very good question, it's technical, but I would say the risk is very, very low in developing blood clots. Because one of the major contributors of developing blood clots in people that have COVID is the fact that they are lying down in one place. In addition to the inflammation, they're also lying down in one place. So if it's just mild COVID and the person is moving around, the risk is quite low. I have not documented in my practice. It may be there in the literature. I've seen literature actually that says someone developed that, but it's very, very low. And in my practice, I've not seen anyone that developed that.
I see. Thank you, doctor. So do you advise people to take blood thinners at this time in the general way?
You mean generally as prevention
yes,
in the community?
Just as a prevention, yes.
No.
No.
If somebody
All
has,
right.
yes, no, that's all.
No.
Okay.
Nobody should take,
right.
again, anticoagulants. Nobody should take aspirin on its own. It will not help. Again, it can cause a serious peptic ulcer situation without the supervision, without the need.
All right. Thank you. Thank you for answering my questions. Thank
Hello,
you.
doctor. Hello, doctor. There is one question I have. Is there Landmark and Onikan facility actively taking COVID patients?
No, they're closed down.
Okay. Thank you.
Any other questions? Otherwise, we would like to close the webinar.
Take up further things. We have another 5 to 7 minutes. Paul Singh Saab will be updating about the Indo-Eye Care Isolation Center, which will be taking up immediately. He has updates from the Ministry of Health. Then our mentors, Dinesh ji, Shiva ji, and Anil Gopani ji will talk something. Then vote of thanks will be done by Praveen ji.
One question has just come. Is it possible that PCR test will show COVID positive if somebody has an ordinary viral fever and cough? Answer is no. If somebody has an ordinary viral influenza or an ordinary cough, it will not show positive unless you have an invasion of corona SARS-CoV-2. It will not show positive. It will show negative. I think Biswalji, over to you.
Praveenji, please take it up further, please.
Over to you and over to our mentors. We are done with the question.
Praveenji, please.
Thank you, Grover Sahab. Thank you, Dr. Akase and Ramesh ji, for this one Galaxy A70. He has raised his hand to say something. So please, you can just unmute yourself and say whatever you want to say, please. So
Go
because,
ahead,
yeah, Galaxy A70. I think Mr. Kenley, he has raised the hand. So going forward, I would like to request and call Mr. Pal Singh ji to just update our initiatives in this forum. Pal Singh ji, please.
Hello, good evening, everybody, ladies and gentlemen. Indo-Eye Care was closed in December purely because there were no patients, and now the patients have started increasing. And we approached Ministry of Health a couple of weeks ago, requested them to reopen Indo-Eye Care. And as per procedure, normally Ministry of Health has to take a approval from Lagos state government, and then once it is approved by Lagos state government, then Ministry of Health takes over to open the isolation center. So we have passed stage one. We have requested them, and Ministry of Health have taken the approval from Lagos state government, and Lagos state said yes, Indo-Eye Care should be opened as soon as possible. So now we have spoken to Ministry of Health again, and they came to inspect our premises today, and they found everything is perfectly in same position as they left. And it is now in hand of Ministry of Health. They are arranging the doctors, nurses, cleaning staff, all medicines and all. According to the information, everything will be ready within 1 or 2 days time. So hopefully Indo-Eye Care will be operational from next week's onward. And once it's operational, we will let everybody know, and they will start receiving the patients over there. And then hopefully the pressure will be less on the community. So that's all I have from Ministry of Health. Thank you very much.
For the awareness of Indian community and for the awareness of all the Samaj leaders, I would like to share that on behalf of SABHA and on behalf of SPAN, our free ambulance services to pick up the patient from your house to take you to the isolation center or hospital is still available. You can reach any of the committee members, any of the task force member. If some of your friends or anybody needs ambulance services, 24/7, our ambulance services for the community are available free of charge. If anybody needs it, please let us know.
Thank you, sir. So today, our Sabha project mentor, I welcome Sri Shiva Subramanyam ji, Sri Dinesh Rathi ji, and Anil Gopwani ji. They are the mentor, and under their guidance, we are working here for the COVID elimination since March 2020, and we are trying our level best. We are trying to do our level best for the community. So now I would like to request our Sri Shiva Subramanyam ji to just advise something and say a few words about the progress and about the initiative taken by us and the working committee of the Sabha. So Shiva Subramanyam ji, please.
Thank you, Praveen. Am I audible?
Yes, sir.
Yes, sir.
Thank you, Praveen. Thank you, Ramesh. And it's a very desirable webinar that was organized at the right time. And Dr. Akase and Chief Grover has done a very good presentation, actually, very precise presentation highlighting the do's and don'ts. And I think Dr. and Chief Grover, I think, highlighted the negative effects of self-medication, which I think as you rightly said, self-medication has gone up so much, because we have got so many WhatsApp doctors. Everyone has got something to advise, actually, So, and that is causing so much of confusion, because if you talk to 5 different people, they give 5 different advices, and so that is definitely cause of concern. And Dr. Akase also highlighted about actually the viral load and its impact of what viral load should be considered serious, what viral load is lighter, and so that is also a very good point, because this is something which no one is giving any attention to. And finally, it actually causes so much of panic. In one company, one guy gets infected, and the infected person is almost like treated like an untouchable, so it creates so much of commotion and confusion in the minds of people. So these kind of webinars are very informative, and it has definitely been very educational and and informative, for all of us. Thank you, Dr. Akase, and thank you, Chief Grover. Because you are an integral part of actually all these activities. So still, and again the timely, and Dr. Akase, I think was very, very informative, and you touched the right points and gave the right points to remember to each one of the members who participated today. And I'm sure they will go and discuss with their friends. I'm trying to educate actually my own team. I got about 50 people actually who are not attending today, but I will keep highlighting these aspects to them also. So Ramesh and Praveen, I think again the entire team of SABHA, I think taking timely action in approaching the Lagos state government, trying to get them actively involved and get activating the Indo Eye Care Foundation. I think it's a remarkable job that you have done. We hope that it acts it starts very fast, because I think there is a sense of fear and panic in the minds of people, as what we felt in the month of April, or little more than that actually now, especially because of few unfortunate incidents that happened in the last few days. So that has created so much of concern and anxiety in the minds of people, and activating our isolation center will definitely give a lot of comfort from that angle. Actually, timely action from all of you is definitely very good. And of course, we are all there with you mentally, morally, and whatever way we can support you. Actually, we are all there actually to support you. So that is an assurance, to all of you. So we are not mentors; we are actually part of you. We will continue to actually, support you the way we have been doing, from April. Thank you very much, Ramesh. Thank you, Praveen.
Thank you, sir.
And thank you, Dr. Akase. Thank you so much.
Thank you, sir. Yes, sir.
Dinesh
Thank
Rathi,
you.
would you like to say something?
Thank you.
Yeah.
Thank you, Siva sir.
Thank you,
Yeah.
Ramesh ji and Praveen ji, for organizing this wonderful webinar. And thank you to Dr. Akase and Chief Grover. I think you have put all your kind of inputs in a very lucid way for us to mull over, and left something to kind of think about. And it's at a very opportune time. I think we are in the midst of the second wave, and this is something which is unprecedented. Actually, the numbers speak for themselves, and these are low reported numbers. Actually, the reality is far bigger than where we are. And just two things I think which can help us, and this is coming from the old adage, which is prevention is better than cure. And there the two things are use of masks. I mean, that's something to protect us, and the other is building your immunity, because this virus, given the rate of transmission being so high, it will get to us, right? So I would leave with those two thoughts. And thank you so much, Dr. Akase. I mean, your presentation, and Chief Grover, I think you guys did a very wonderful job. Thank you.
Thank you, Dinesh ji. And now I would like to request Sri Anil Gopwani ji, please say a few words about our initiatives and suggestion.
Good evening, everybody. Mr. Siva and Mr. Dinesh. Hello, good evening.
Good evening, Chief.
Yeah, Mr. Siva and Mr. Dinesh has said everything. So I would say only thank you to the SABHA and the whole team. Thank you very much to everybody.
Thank you, sir. So next,
I
Ramesh,
request Praveenji to give a vote of thanks
sir.
to everybody, and really it is
Thank
nice
you.
for every participant's plan, please.
A special thanks to Dr. Akase for his valuable time and busy schedules. He is here and give us the very good presentation and lesson how to prevent the COVID-19 second wave. And as well as our Chief Grover, he is a pillar of the SABHA for the all medical guidelines and medical setup. So I thank you very much.
24/7.
4/7.
No, yes, it is, Dr. Chief.
So thank you very much, sir, Chief. Grover Saab. Thank you, Ramesh ji, for guiding us for this whole Sabha initiative. Thank you, our mentors, and a special thanks to the all participants here for this wonderful session. Today's participant list I have seen, there is a 110 people. They are here and very, they are listening very well for this session. So a special thanks to the all participants, and due to their courage and encouragement for us, that is why we have concluded today's 20th webinar. So thank you everyone. And thanks to the all Samajam presidents who is present here. I think there is no time to read the all list 64 people name, and everybody is here. So my apology, and thank you very much to you for your supports and the donors, individual donors and corporate donors. Everybody is working here for us. That is why we are doing and we are serving to the society. So thank you very much, everyone, sir. And we are looking forward to the good result and elimination of COVID-19 second wave also. And as our Chief Grover, Mr. Ramesh ji, our mentors, they are saying about the isolation center, it is going to be open very soon, and hope it should also vacate like last time. So no patient and hospital will be available. So I pray to the God, so nobody will be infected and go there. So thank you very much. Thank you very much, everyone, sir.
One more special thanks to Paul Singh Saab, because with his initiatives with the MOH, it is going smoothly. Everybody in working committee, Dinkarji and all those people, including Chief Grover, Kamadji, Mukesh Bhattji, even Anil Gopwani, everybody was there. So with their initiatives, the thought has come before 2 weeks. We thank you, Paul Singh Saab, especially, and all the Sabha committee members.
Thank you.
Yeah, thank you, sir.
Thank you. Thank you.
We'll have one more.
Thank you, sir. So
very quickly.
Next webinar also, it is going to be announced very soon. Okay. We are trying to bring medical expert from India as well as Nigeria also. So let us see when we are going to again the next webinar.
Thank you. Thank you,
Thank
Ramesh.
you.
Thank you,
Thank you all.
Praveen.
Thank you.
Thank you, all the organizers.
Thanks.
Thank
Bye.
you. Thank you. Bye.
Thank you.
Thank you, everybody.
Thank you, madam.
Thank you, sir. Thank you, sir. Good night.
Thank you, everyone.
Thank you.
Thank you, sir.
Dr. Akashi, thank you. Chief, really thanks go to you with the short notice to arrange the doctor, to arrange the doctor in the short notice.
Short notice.
Not even 24 hours. Not even 24 hours. So
Yeah.
thanks a lot.
Actually, initial
Yes,
plan was to do
12
it on
o'clock.
Saturday. We wanted
Yeah.
to do. He
Yes.
committed for Saturday, but later on, due to Sanyukt Bhartiya Divas, When I had to request him yesterday to change it to Friday, it was so quick. And he was very busy yesterday in Luth. The entire isolation center is full in Luth. He was very busy.
It was very really informative
Yes.
and very good presentations by Dr. Akase and equally.
Very good.
Yes.
And Doctor, and you know, Mr. Rameshji, Chief Grover and myself has made this flyer in the midnight. Okay. Then he
yesterday
he needed the offer letter, offer invitation letter. So I did at 11:10, 12:10 to the offer letter. Then I sent him.
It was a midnight fire. It was a midnight fire.
Midnight fire, yes. And it was successful, sir. 107 people in the short notice, they are here. This is the good achievement, actually.
Actually, there is a lot of panic. There is a lot of panic.
People are looking forward. No, still people are looking forward to, and they have a belief. So our work is going in the right direction.
Thank you,
society.
Thank you for your midnight burnings yesterday, candle burnings. Really,
sir, this midnight burning, you have burned the lighter, sir. So you have burned the lighter.
हम तो बोल के सो गए, आप तो काम किया कल भाई, मैं तो सो गया.
नहीं, आप सो गए. आपने तो किया ना कि आपने आग लगा दिया और सो गए. लेकिन आग लगाना भी बहुत बड़ा काम है. शुरुआत करना itself it is a very good work.
But in
आपने
reality,
शुरुआत कर दिया तभी तो काम हुआ. अगर आप शुरुआत नहीं करते तो नहीं होता.
On a serious note, Bishwalji, on a serious note, situation is very bad because I contacted all the hospitals today.
That is why Paul Singh साहब भी है. आप भी कल से लग जाओ. मतलब कल शाम तक डॉक्टर लोग को ले आओ और हॉस्पिटल खुलवा दो सर.
Today evening, 28 Indian citizens are admitted in different hospitals. I collected the details and data from all the hospitals. 28 Indian citizens are currently infected in a severe condition. They are admitted in various hospitals. Situation is bad and it is spreading like wildfire in our Indian community.
Chief, I need one bed in Vedic now. Actually, I am about to call you. Just I got the message. I need urgently a bed in Vedic.
All the beds are full. There is no bed available in Pelion and Vedic Life.
पालियन में एडमिशन था. पालियन से 2 दिन पहले उनको बोले कि तुम्हारा ठीक हो गया जाओ. अभी घर में उनको बहुत जबरदस्त है. क्या कर सकते हो?
याबा ही बेच सकते हैं सर, और कुछ भी नहीं कर सकते. याबा IDH याबा बेच सकते हैं. वहाँ पे बेड अवेलेबल है.
You need a ventilator, but याबा में नहीं ventilator. हाँ.
No way. The ICU is full in Vedic Life. No bed available.
ठीक है, मैं बात करता हूँ आधा घंटा का अंदर में. There is somebody will call, maybe chief will call you.
Okay.
और ये अभी रेडिंगटन आज जो इनॉग्रेट किया उसमें कुछ है ना क्या VI में? रेडिंगटन VI
वो अभी चालू नहीं हुआ है सर.
आज आया ना कुछ. आज कमिश्नर एंड हर्बर्ट दोनों मिलके खोल दिया बोलता है.
नहीं, लेकिन वो ऑपरेशनल नहीं हुआ अभी आज मैं मिला था उनके आदमी को. अभी चालू नहीं किया
सर. अभी कितना 2 घंटा 40 मिनट हुए. अभी आपको लग रहा है कि आप कितने इनर्जेटिक हो ग्रोवर साहब. मतलब आई एम इंस्पायर्ड. आप इस टाइम में इतने एनर्जेटिक हो. आप अगर यंग रहे होंगे तो आपने क्या क्या किया होगा.
अरे 24/7 में जो बोला उस टाइम क्या गलत बोला. आप देखो
वही तो
हो गया है ग्रोवर साहब.
मतलब मैं थोड़ा थका लग रहा हूँ, लेकिन ग्रोवर साहब तो थक ही नहीं रहा है यार. मैंने पूछा भी है कि कौन सा मेडिसिन आप लेते हो, कुछ बताओ हमें भी. तो कुछ बता भी नहीं रहे हैं, खाली कोविड बता रहे हैं.
क्यों मजाक कर रहे हो सर? क्यों मजाक कर रहे हो?
नहीं रियल
मजाक नहीं कर रहा हूँ. रियली यू सबसे बड़ी बात है कि यू आर ऑलवेज चीयरफुल. फर्स्ट थिंग. रमेश जी का तो आप कभी गुस्सा में भी देखोगे तो इनका जो है दांत नजर आएगा और हंसता हुआ चेहरा गुस्सा में भी है ना. और आपको देखो तो आप हंसते हुए रहोगे चाहे कितना भी स्ट्रेस हो, है ना.
क्या करें और क्या करें
सर. अभी तो पूरे इंडियन कम्युनिटी का दारोमदार जो है वो डॉक्टर सिन्हा के नहीं रहने से सब आप ही के ऊपर है अभी. तो इसलिए मैं कह रहा हूँ कि हॉस्पिटल को जो है अभी जो भी आपने बेड वेड लगाया उसको और डबल ट्रिपल कीजिए।
अपने को वेंटिलेटर्स भी अरेंज,
स्पेशलिस्ट
we
डॉक्टर
need to arrange the ventilator also. We need to arrange the ventilator.
बट अभी मत बोलिए, वो बात हुआ है कि मतलब अभी वेंटिलेटर हम करके जिस दिन एडमिशन हो जाएगा डॉक्टर लोग आ जाएंगे उसका नेक्स्ट दिन बात करेंगे, उसका पहले नहीं।
ठीक है सर,
ओके।
तो अब मीटिंग को अंत करें।
हाँ, तिरुपति भाई,
नहीं तो डिनर करने के बाद तो हम लोग रात भर बैठ सकते हैं।
जी, संग्राम जी, परिमल जी, थैंक यू, कमल साहब थैंक यू,
प्रसन्न जी, संग्राम साहब हैं, संग्राम साहब
थैंक यू सर,
सेनापति जी, भवानी शंकर देखिए, शकल नहीं दिखाएगा कोविड में कैसा लग रहा है भवानी, लेकिन फोटो दिखाएगा।
ठीक है सर,
कमल जी थैंक यू।
गुड। सो चलिए सर, फिर हम लोग लगे अपने काम में, हॉस्पिटल खुलवाने का। हॉस्पिटल खुलेगा उसके बाद बुलेटिन फिर निकालना पड़ेगा, लगातार वेबिनार भी करना पड़ेगा। ठीक है सर,
अभी तो बुलेटिन रेडी करा दो अभी ये वाला वीक का। कल जैसे निकलता है शनिवार को निकाल दो।
हाँ, शनिवार को जैसे होता है वैसे निकाल देंगे फिर।
कल निकल जाएगा।
ओके सर,
ओके जी, थैंक यू
सर, गुड नाइट।
गुड नाइट। थैंक यू एवरीबॉडी।
संग्राम बाबू थैंक यू।
संग्राम बाबू थैंक यू। ओके सर, लेट अस क्लोज।